Bed blocking occurs when services are forced to keep a patient in hospital because they cannot be transferred back into the community. And it costs the NHS £287 million a year. Housing Association East Thames Group is calling on NHS commissioners and doctors to work with them to achieve efficiencies and better outcomes for discharged patients.
When a patient doesn't have a suitable place to go, health managers are prevented from releasing them into the community, and this represents a significant drain on money to the tune of £287 million a year and on resources. Well, East Thames Group say there is another way, and one that allows residents to lead a rich and full life in an independent home from home. Charlie Colshaw is the Director of Care and Support at East Thames.
We support over 2,000 vulnerable customers, ranging from people with mental health needs, people with learning disability, young people and also older people. We have properties around the East End of London and also Essex, and we are a registered social landlord which has a range of properties from affordable rent to shared ownership to outright sales. I think there are a number of reasons for bed blocking. I think we all have to work together better. So housing, health, adult social care, if they can all work together in a more streamlined way, that would help the problem.
At East Thames property Verdon Row Court in Chingford, scheme manager Victoria West also believes their approach helps to prevent bed blocking.
We're on site 24 hours to deal with any emergencies or spot anything that may need medical attention that we can support on site rather than sending them into hospital.
Draywood Court is an East Thames extra care scheme for people over 55 with a support need.
We have a range of residents here, so it's about 111 residents in total, and you can have people who are sort of double-handed care through to people that are quite independent. We have a whole range of health conditions, disabilities, learning disability, mental health, but we try to create a community in which everyone can live together.
One of those residents is Pat, who moved into Draywood Court after 36 years living in her own home around the corner. Can you imagine what your life would have been like if you hadn't have had this place to come to?
I'd have been a lonely person because I've got no family, only nieces and nephews, and they're all scattered around England.
We try and create a community by involving residents in everything that we do. So we have extensive consultation to cover anything from the restaurant service, the type of facilities that are provided here. So we've built a residents association, and which run independently, and then we work with them to help shape the service.
Resident Kevin has found the move into extra care life-changing.
Oh, I loved the place. Absolutely loved it. And it was nice to find out I could get my independence back. I could do things without carers coming with me. So yeah, this is heaven. Pleased with the way life's going now. Come to terms with my injury. Yeah, very glad to be here.